Hi, my name is Linda Wasson. I'm going to be teaching you about fetal circulation. This video is for novice and or veteran nurses that have some prior knowledge about circulation through the heart, so that we have a baseline of what we already know, and then we're going to move on to fetal circulation. So does anybody remember what these are right here? Which valves?
Inferior and superior vena cava.
Very good. That's the superior vena cava and the inferior. So the blue is deoxygenated blood that comes in, and it comes into the, who knows this one?
Right atrium.
The right atrium, that's right. So it goes into the right atrium, and then it goes through this valve right here. Who remembers this valve? Tricuspid.
Tricuspid.
Yes, so the tricuspid valve, and then it goes into the right ventricle. Very good. So there's our right ventricle. So you have deoxygenated blood, then it goes through another valve. Who remembers that valve?
Pulmonary.
Pulmonary. Because from here it goes into the
Pulmonary arteries.
right, the pulmonary artery that goes into the lungs. So it can be oxygenated. So once it gets into the lungs, it becomes oxygenated, comes in through the pulmonary vein, and from there it goes into the
Left atrium.
The left atrium. There's, oops, passes the, which valve is this one?
Mitral valve.
That's right, mitral valve. Good job. And so from the mitral valve it goes into the
Left ventricle.
very good, left ventricle. And, oh, sorry, uncovered the wrong one. Okay, so then left ventricle through the aortic valve and through this big old one here. Who remembers that one? The aorta. The aorta.
Fetal circulation. Yahoo! Fetal circulation. Circulation time, come on. Let's circulate. Circulation time, come on. Let's circulate. Get oxygenated blood from here. The placenta with oxygen and nutrients. Blood moves through the umbilical vein, bypasses the liver through the ductus venosus. Circulation. Blood flows from the inferior and superior vena cava. Circulation. To the right atrium and through foramen ovale. From foramen ovale to the left atrium, since lungs are not fully functional, most of the blood bypasses right ventricle. Yahoo! Learn about circulation. Yahoo! Circulation time, come on. Fetal circulation. Circulation time, come on. Let's circulate. Blood enters into the left atrium, goes to the left ventricle and to the aorta, flowing to the body. Now a small amount of blood flows into the right ventricle and to the lungs. Come on now. But most of the blood is shining to the aorta. Circulation. Through the ductus arteriosus where blood pumps to the body. The oxygenated blood comes from the body, where it runs through the umbilical artery, where fetus returns waste to placenta. Yahoo! We learn about circulation. Fetal circulation. Circulation time, come on. Let's circulate. Come on now. Circulation time, come on. Let's circulate. And the cord is cut. Let's celebrate. It's alright. With baby's first breath, there is a rise in oxygen. Let's celebrate. It's alright. Vasoconstriction occurs and circulation change. Then the new baby beats right up. Let's celebrate. It's alright. Oh. Yahoo! Circulation. Come on. We just learned about fetal circulation. Celebration time. Come on. Now you know how fetal circulation works.
So this is gonna come from the placenta.
Right.
To oxygen-rich blood is gonna come from the placenta.
Good.
Through the umbilical vein. It's gonna go past the ductus venosus, up through the inferior vena cava into the right atrium,
Very good.
and go past the foramen ovale into the left atrium.
So remember, when it's coming from the inferior vena cava and the superior, it mixes in the right atrium. So you would have purple over here. Good. You just squish it down in there. That's fine. And then you've got some blue over here. So this is deoxygenated blood, or oxygen poor blood. So this is coming from this way, right? One that bypasses the liver, and it is the
Ductus venosus.
very good. And then it goes into the inferior vena cava, into the
Right atrium.
very good, to the right atrium. Oh, sorry, my right atrium here, where it mixes with blood from the superior vena cava. Okay, and then it goes through this little valve.
Foramen ovale.
Very good. And then it goes into
The
right,
the right
I mean the left
atrium.
atrium. A small amount of it goes to the lungs, but because the lungs are the lung vessels are constricted, it flows through the path of least resistance and will go through the ductus arteriosus.